Ladies and gentlemen, you're about to witness history. I present to you the lobotomy. Juvenile distraction, lesbianism, mania, all of these maladies can be reversed.
But then, aren't we playing God?
Easier than curing a toothache, an ice pick, a skull, and the promise to erase pain by erasing you. What if we told you there was once a surgery so barbaric it involved sticking ice picks into the brain? It's hard to believe it wasn't just real, but celebrated as a medical breakthrough. Welcome to the Revelations Room, and today we are diving into one of the cruelest chapters in medical history.
If we gave her a transorbital lobotomy, crack that thick skull open like a walnut.
In the mid-20th century, mental illness was seen as a puzzle, with asylums, hospitals overflowing, and millions of dollars worth of treatments overcosting. Lobotomy emerged as a radical solution, cutting, quote, destructive connections in the brain, quote, to cure patients. But at what cost? Lobotomy was once considered a miracle cure for severe mental illnesses like schizophrenia, homosexuality, OCD, depression, and many others, even migraines. Often the procedure was popular by the doomed society itself and promised some sense of control for families who had mentally unstable members. Still, the reality was far from the promised cure. And were they really that, quote, unstable today? What started as a hopeful innovation spiraled into a medical catastrophe. Imagine living in a century where mental illness was treated with electric shocks, insulin comas, or even induced malaria. Lobotomy was seen as a treatment and cure for madness and homosexuality treatment back then. In 1935, Portuguese neurologist Egas Moniz introduced the world to lobotomy. Moniz believed breaking connections in the prefrontal cortex would stop obsessive thoughts and grant emotional stability. His first 20 patients were successful, but the rest were never properly studied. Moniz's success spread like wildfire. Doctors worldwide hailed the operation as revolutionary. Moniz even received the Nobel Prize in 1949, but cracks in this miracle cure began to show as patients became shells of their former selves. Yet lacking better options, the government, trying to find more affordable ways to support soldiers with PTSD after the war, didn't monitor surgeons for a couple of decades. Moniz's procedure set the trend of a global medical craze that prioritized quick fixes over ethical concerns. Ironically, in 1939, Moniz was shot multiple times by the schizophrenic patient, but the doctor survived the assault. Back in the US, an American neurologist named Walter Freeman, fascinated by the lobotomy procedure, continued Egas Moniz's legacy. Using an ice pick-shaped device, Freeman developed a method to perform the lobotomy much more easily. The practice involved inserting an ice pick through the upper portion of the eye. Previously, the procedure required general anesthesia and drilling holes in the front of the skull. Freeman, however, performs it in an outpatient setting, which sounds unbelievable even now. Freeman traveled across the country visiting mental institutions and spreading his methods to institution staff. Rumor has it that he referred to the van he traveled in as a lobotomobile, where he performed hundreds of lobotomies. What happens when ambitions and societal pressure meet unproven medical practices? Surgeons asked the young woman on the operating table to sing the national anthem. Rosemarykennedy, the eldest daughter of America's most influential family and sister of future President John F. Kennedy, tried her best. Her voice trembled, and by the time she mumbled, doctors already finished damaging connections in the frontal part of her brain. The operation lasted minutes, but its effects lasted a lifetime. Lobotomy left her with the mental capacity of a toddler. Her father, Joseph Kennedy, viewed his children as tools for legacy, grooming his sons for greatness and neglecting his daughters. Rosemary, born with developmental delays due to oxygen deprivation at birth, didn't fit the character. Kind but misunderstood, she struggled with epileptic seizures, mood swings, and outbursts. For a family obsessed with reputation, she became a shame. When her symptoms worsened in her early 20s, Joseph Kennedy, without consulting anyone, put his daughter under the knife to make his child behave the way he considered normal, and failed. Instead, Rosemary spent the rest of her life in institutions, abandoned by her family for decades, and it was hidden from the public. A truly lucky case was Howard Dully. Just at 12 years old, a poor, gloomy teenager was lobotomized at his stepmother's request for being disobedient after the death of his mother. He spent decades piecing his life back together, haunted by what was done to him. He survived and could successfully recover due to his young age. His brain simply rewired itself. Patients like Rosemary were left as shells of themselves, often reduced to a vegetative state. Others, like 12-year-old Howard Dully, were lobotomized for minor behavioral issues, while others died from complications. By the 1950s, psychiatric drugs like Thorazine offered safer alternatives, and lobotomies fell out of favor. But the results were disastrous. Initially, lobotomy was used on patients considered hopeless, those left to languish in asylums with little chance of recovery. But as Freeman promoted the procedure, it became more popular and widespread, leading to tragic stories like that of Rosemary-Kennedy. What are your thoughts on this controversial procedure? Do you think doctors like Enigmatic and Freeman were visionaries or villains? Let us know in the comments below. Don't forget to like, subscribe, and hit the bell for more untold stories.